The next big thing now is let's build mental health facilities. So just like they did in the 90s with prisons, now they're looking at the same thing when it comes to mental health. And who is looking at that? All these mental health facilities, most of them are being built out of network. They're building them in Montana. They're building them in Idaho. They'll put one in South Dakota where you have to travel to them.
Yeah.
All of it out of network. And why do they do that? Because they can charge whatever they want as an out-of-network claim.
Hi, and welcome to Captivating Health Insights. Today, we're talking with Adam Russo from the Phia Group on all things mental health parity. Welcome, Adam.
Thanks. It's great being here.
Would love to hear about how you got into this industry and your story of how you got here today and with the Phia Group.
Well, listen, we could do a whole podcast just on that.
We could. I apologize. Yeah, we'll have to have the short version today.
I will give you the abridged version. So I'm an attorney, and obviously I love the practice of law. But I started Phia 25 years ago, February 7th, the year 2000. And the reason I started the company is because I thought the way that people were doing cost containment, third-party administrators, self-funded employers, at least back then, was archaic. I was able to see that no one was looking at a plan document. So to me, the craziest part was everyone was talking about, let's identify claims that maybe another party is responsible for. Let's identify claims that are overpaid. We should have paid less. Let's identify claims that were paid in error and recoup those funds from the facility or whatever, or maybe even not have to pay those claims because there were mistakes to pay them in the first place. But no one was looking at the actual summary plan document. And when I say nobody, none of the other 50 companies at the time that I started Phia had any discussion, whether their website or their literature, I think websites just started around then, or their literature talking about compliance, plan design, reviewing the SPD to make sure that not only is it compliant based on the current law, but that there were some type of cost containment features within the plan. So I said, if I can make a self-funded plan document stronger with more rights, more duties of the member to cooperate, etc., then we'll find more fraud, more errors, more claims that should have been paid by an auto insurer, example. So when we started the Phia Group back in 2000, one of the key components was the fact that we will review your entire plan doc for free.
But what you're saying is wild, though, because the plan functions according to what's in the plan doc, right? But you're saying people weren't looking or negotiating or doing anything with the plan. I mean, not doing anything, but virtually not doing anything with the plan doc, which is wild.
The only people that were looking at the plan doc were either in-house counsel, in-house compliance people, or you would hire a law firm. And as you all can imagine, law firms are expensive, right? To hire a lawyer, you're spending half the money you're spending is to educate the law firm or the lawyer about the specifics of your plan. We're self-funded, we have stop loss, et cetera, et cetera. And it changed the game. And the beautiful part about the work that we do when it comes to plan design is that it tells you the entire story of what the employer is doing. You see the schedule of benefits. You see what's covered, what's excluded, what network they work with, what stop loss carrier they work with. Do they have incentives for members to actually care about the cost of care? Do they have steerage mechanisms? Do they carve out dialysis treatment? Just what they do.
Yeah.
Is it a basic run-of-the-mill plan, or is it truly a innovative, ahead of its time plan design? So that was our idea. We started the company with a total of $8,000 in my mother's basement, and we've never purchased a company. We've never acquired anyone else. One plan at a time, one broker at a time, one administrator at a time. And today we have close to 300 employees. Our main office is in Canton, Massachusetts, just south of Boston. And we have a large regional office in Louisville, Kentucky, with close to 80 people. Another 20 people in Boise, Idaho, that handle all of our appeals, et cetera. And just random folks all across the country, and we continue to grow. And I'm expecting our organization to double in size within the next 5 years at a maximum.
Amazing. And I know you started it in your mother's basement.
Yep.
So from 25 years ago in your mother's basement to 300 employees, it's amazing.
We're always coming up with ideas, like a what if. What if we did this? What if we did that? Now, I can't test that stuff on actual clients, but I sure as heck could test it on my own employees.
Yeah, exactly.
So we run ideas, programs, processes. There is not a service or a vendor, stop loss, anything that we do that we first haven't vetted on our own plan, which is self-funded, obviously. Not only vet to make sure that it works and that it could save money, but that the implementation process to make it happen is as smooth as possible. And I think that's one of the biggest issues that most vendors in our industry see, because in our industry, now everyone wants to be part of self-funding. Everyone wants to be in captives.
It's cool now. Yeah.
It was not cool 10 years ago. So all these companies that come into our industry for the first time, they think, oh, it's cookie cutter. You could just plug it in. And that's not how it works. And so that's one of the cool things about our ability to grow, is that we care about our employees. We're really trying to innovate. We want to give them opportunities to continue to succeed and, raise their family and make more money and have more opportunities. And that recipe's worked so far, and I hope it continues to work.
That's awesome. No, you built a great organization, and a lot of our, captain members work with you guys and get their plans reviewed, and it's an important part of being self-funded. I have a question for you, how it relates to mental health parity and our topic today. Would you say that a good analogy for mental health parity, making the mental health benefits comparative to the medical benefits,
right,
is it like Title IX? Is that a decent analogy to say that, hey, like at one point it's like there's all these men's sports, got to have women too, and there's good things that came about from that, and there's unintended consequences too. Is it similar? Is that a decent analogy?
That's a great analogy. I love analogies, by the way. So anytime you want to throw one in there,
okay,
I think it's fabulous. But it is. It's exactly the same thing, right? You have all these, going back before Title IX, you had all these sports at colleges, and you'd have 20 Division I, 2, or 3, or NAIA sports available for men, and you'd have 3 for women.
Right.
And it's like, how is that fair? Especially in a situation now where actually more women go to college than men do, right? Overall percentage-wise.
Yeah.
So, yes, 100%. You could look at it that way. I would say the key difference, though, goes back to, it's one thing to go, here's a sport, here are your scholarships available, right? For men and for women. When it comes to mental health parity, we're going to cover this for your medical injuries, medical needs. We're going to cover this exact same thing when it comes to your mental health needs. Same copay, same deductible. The problem is, and they can even say same access. The problem is charges.
Okay.
That is the major, major difference, is that there is so much pressure put on by patients, by facilities, to try to get the plan to pay whatever amount of money they are asking for when it comes to claims.
Right.
And that's the problem. Another analogy, let's use this one.
Okay.
Go back to the 90s, okay? Again, I'm not talking about Democrats, I'm not talking about Republicans or independents. I think, when it comes to health insurance and health care, none of them really have the answer. A lot of ideas have been tried, some good, some bad. There are great things about the ACA, Obamacare, the great things about it, like unlimited benefits. Who doesn't like that?
Preventive, yeah.
Right? Having, your children up to age 26. Who doesn't like that, right? Especially in a job market where it's maybe tough to get a job after college and you got student loans. All that's great, okay? But back in the 90s, we had a crime problem. And one of the things that Bill Clinton did at the time was they said, okay, we got to find a way to fight crime, okay? We got to figure out a way to, murders were up, crime is up, capital crime, people felt unsafe. So what do? Built prisons. And they built prisons all across the country. Now, who's against that? Nobody. Why? When you build a prison, depending on certain districts, right? I mean, again, no one wants a prison in their backyard, right? Not in my backyard.
Of
NIMBY,
course.
Okay? But there's plenty of places in this country where you don't have a neighbor, or it used to be a factory and went out of business. So what happens when you build a prison? Now you have jobs to construct the facilities. Now you have permanent jobs at the prison. My dad was actually a prison guard.
Oh, wow.
For a long time. So now you have prison guards. Now you have prison staff. Now you have personnel, HR, all the other things any other company would have.
Right.
And guess what else they need? They need somewhere to go to lunch. They need somewhere to get a haircut. They need somewhere to get their gas. So you've literally built around a prison, depending on where it is in the country, an entire brand new, growing economy. Mm-hmm. People love it. Everyone loves that, right? We're growing jobs, especially for representatives in D.C. who are always questioning, like, where are jobs? We added 5,000 jobs in our district. The same thing is happening now when it comes to mental health. Because of the lack of mental health facilities, are you aware of the fact that right now there's a shortage? Forget facilities actually being able to go into a place and be treated. If you want to pick up the phone and call a hotline and just talk to a counselor, they're running out.
Are they?
There aren't enough people to even take the suicide hotline calls.
Really?
Yes. So there's a huge shortage of access to talking to people on the phone. So what they say now is, well, we'll use AI. I'm not so sure.
Ooh, yeah, that's a whole nother topic.
Right.
Yeah.
How much that's going to be able to help when it comes to actual support of a person who
is in crisis. Yeah.
Is in crisis for whatever reason. Right. So what are they doing? The next big thing now is let's build mental health facilities. So just like they did in the 90s with prisons, now they're looking at the same thing when it comes to mental health. And who is looking at that? All these mental health facilities, most of them are being built out of network. They're building them in Montana. They're building them in Idaho. They'll put one in South Dakota where you have to travel to them.
Yeah.
All of it out of network. And why do they do that? Because they can charge whatever they want as an out-of-network claim. And if your plan gets a $100,000 bill for a 1-month stay in an inpatient at a mental health facility, and you look and go, this is ridiculous.
Yeah.
The most we should be paying for this is $30,000. And you say, we're going to deny the claim, not because you don't need access,
right?
Not because you don't need the care, but because what they're charging is literally outrageous. What happens? Automatically, every facility has trained the population. Here is how you appeal. Here is how you pick up the phone, call the Department of Labor to their hotline to start an audit process. All the audits that the Department of Labor does on plans to see if they are actually have mental health parity, it isn't like they're grabbing a list of companies and randomly picking one. Every single company that has been audited by the DOL, it's because somebody called their hotline, somebody complained, and typically it's a member or a family member of a person who is being either denied some access or completely denied access because of the example I just gave you. So we see all across the country now this consolidation, these purchases of all these mental health facilities by these large organizations who own them all. If you own them all, you can charge whatever you want. They have trained the billing departments how to work with the members in regards to appealing claims, how to push back on claims, file claims with the DOL. And who's made to look like the bad guy? Every single employer.
Yeah.
Regardless.
So that's so interesting. So what's an employer to do both in a proactive situation? How do I keep maybe some of this from happening while also giving access, and also reactive? If this already happened, I have this huge claim. What does an employer do in both those situations? So
before I answer that question, I just want to make one more point.
Yeah.
The same problem that we saw in the 90s is the same problem that we have now. In the 90s, instead of figuring out, hey, how do we lower the number of criminals? How do we get people to be educated and have access to jobs so they don't have to have a life of crime?
Right.
Instead it was, hey, the more criminals, the better. I mean, you've heard the stories of judges, who are paid off to continue to send people to prison, like juveniles, like these juvenile detention centers that are all privately owned. Literally, we're paying off judges to send them, and the more kids they sent to these detention facilities, they actually got paid more.
I didn't know that, actually. That's
huge
very,
stories.
very corrupt. I didn't know that.
Same thing when it comes to this. Instead of, okay, let's continue to just build and build and build all these mental health facilities to deal with heroin addiction, fentanyl addiction, depression, suicide. How about we try to get the number of kids addicted down?
The root of the problem.
The root of the problem.
Versus the symptom.
So
treating
now
the symptoms.
to answer your question, the first thing that people need to do is actually look at their data. Nobody does. It's amazing to me, okay? All I know is if my wife and I decide we want to go food shopping, okay? We go to the store.
Yeah.
And then you get a receipt. And on the receipt, you can see all the things that you bought and how much it cost. And then you go, all right, you can make decisions on what you want to do in the future based on the actual data that you're looking at in front of you. I mean, people all have, you have apps on your phone, that tells you spent 25% on dining. You spent 10% on this.
Right.
You spent 20 hours today on your phone.
What are you doing?
Right. It's the same thing when it comes to healthcare, but people don't look at it the same way. Look at your claims data. Okay, here's all your data, raw. Don't just rely on your broker or some other organization to give you I love these. The number of times I have asked an employer or a broker to send me data on healthcare spend, I'm waiting for an Excel spreadsheet. I'm waiting for like thousands of rows of data with every single, nobody's PHI. I don't need to know who. I just need to know what, right? And how much is being spent. Procedure code, diagnosis code, charge amount, paid amounts, in network, out of network. Very simple. I'll get this one-page glossy document. It has a pie chart, and it says 3% out of network utilization, 30% discount, 25% in network utilization, 10% of the people go to facilities, 90% of the people go to physician networks. And I'm sitting there going, yeah, that's not the data. That's just a nice one-page snapshot that you want to be able to show to your client upon renewal. I want to see the data because the data is going to tell you everything you need to know.
Yeah, you can't do anything with that pie chart. You need to know what's actually going on under the hood.
So, and every employer is different. So we take that data, and today with all the technology, it's very simple to do. I mean, it literally takes us 30 minutes. In 30 minutes, I could take any plan, I don't care what size, and look at their claims data and literally tell them, this is what's going well, which who cares? It's going well. This is what's really bad, and this is what's trending in the wrong direction just based on past claims history. And you'll also see how many people are actually utilizing the doctor. And it's not a coincidence that when you see lower utilization, you go, why is utilization lower this year than last year? Or why was utilization less last year than the year before? And the answer that people love to try to give is, people must be healthier. All of a sudden, they're not going to McDonald's.
Right.
They're not eating fast food. Everyone must be doing a 5K. It's all a lie. No. The reason is, deductible went from $5,000 to $8,000. Copay went from $50 to $100. People have less money to actually be able to afford their out-of-pocket expenses, so they're waiting. Yeah. They're not getting treated.
Yeah.
And the same thing when it comes to mental health. We look at the data and it's going to tell us, all right, how come there's no telehealth being utilized? What's going on there? What's missing? So you look at the data and you identify all the issues, and then you look at the plan. What's the plan doing about these particular issues? One, you want to know if the plan's compliant. That's, we do that every day.
That's table stakes. That's table stakes. Yeah.
And the sad thing is most plans aren't. But we get the plan compliant. Next, okay, what are they doing about these problem areas? These guys have the best vendor in place. Everything's there. It's beautiful. It looks perfect. Okay, why isn't it working? How many people do you think, right, if you had to guess, out of 100 that are on a plan, actually have read the plan?
Like 0.5. 0?
I think your answer's pretty much right on. The only people that read a plan document, including me, like in my own life, is if a claim isn't paid.
Right.
That's the only time.
There's a problem.
No one goes, it's a Saturday afternoon. Let's read the SPD. Let's sit back and have let's have maybe, a whiskey,
Yeah.
Maybe neat.
Nothing
And let's,
sounds better.
Look at the sunset and let's read our plan document, honey, and let's talk about it. I mean, can you imagine? I'd be divorced if I actually recommended to my wife that we should read the Phia group as the summary plan document.
I want you to try it sometime and like secretly videotape it and like get her response.
No, I'm not doing
That'd
it.
That'd be hilarious.
I have way too much to lose.
That'd be hilarious.
If I ever tried that. But you're right. It's very few. But 100% of people whose claims are denied will potentially look at their plan. No, appeals are a whole nother discussion, another segment, okay? So let's say it's one person. Great. So you have the plan. The plan doc language is perfect. Everything's covered. Then why isn't anyone utilizing the service? How do they know? If they're not reading the plan doc, how do they even know that service exists? Now, somebody could say, a smart broker will sit there and tell me, well, Adam, we have the enrollment period, or we send emails out to the membership telling them about this new vendor and new opportunity. No one reads them at all. It's a major problem. And we see it all the time. Like, how do you get people engaged? How do you get people to go, this might be a service that is going to benefit me? And here's the crazy part. It actually benefits the person.
Right.
You don't have to necessarily incentivize them with money, but just tell them, hey, if you ever have this situation, here's what you can do. No cost to you, no out of pocket, whatever it is. Here's the actual, service. And it's just not done. It's almost as if it just stays within the administrator. It stays within the captive. And maybe the HR people know. But that's the biggest problem, is that most of the time, even if your plan doc's compliant, even if your data tells you the right story and your plan fits perfectly, if people don't know, or if people aren't reminded to know, they're not utilizing the service. I can tell you that 95% of innovative ideas that are implemented, that are in the plan, typically don't work because they have never, the message and the process and the idea and the savings have never actually been truly understood or embraced by the overall population. And there are so many ways to do that nowadays. Like, how about an example? You don't have to even use a real person. Make them up. Susie in accounting. Doesn't even work there. Here's what happened. Here's what the process was. And look at Susie today.
Yeah.
People love stories.
Yeah, they remember stories, yeah.
One of the only reasons I think that I'm ever asked to speak at any conference, and I'm very blessed that I have, had the opportunity to do it hundreds of times, is that I don't read slides. You share stories. You literally, I don't want to call it dumbing it down, but you just bring it to a real level. The problem with our industry is most people feel like we're solving cancer, or like we're curing a brain disease, or we're going to the moon or to Mars. I'm not Elon Musk. This is not a hard thing. It's all about making sure you're compliant, check, making sure that the people are aware of what you have as services, check, and then give them examples of wins, successes, case studies, promote it. Go, hey, we're having a pizza party next Friday. All the pizzas for free, but at the same time, they also have to watch a 5-minute video on telehealth or direct primary care or whatever it might be. And those are the things. You have to remember, when we talk about mental health parity, think about this. How long does the average person wait just to get a doctor's appointment?
A long time, yeah.
And you realize there's a massive shortage, and they expect the shortage to be even bigger regarding primary care physicians because the doctors graduating from medical school, you have all these bills, and we all know the price of college and grad school, et cetera, medical school. I mean, it's just growing every year. There's a lot of pressure on these doctors, these young doctors, to get jobs where they make enough money to pay their student loans and live. Primary care isn't where you make that money.
Yeah.
So we don't have a shortage of back surgeons. There's plenty of surgeons that can help you with your weight loss.
Right.
Plenty of pharmaceutical drugs for that. But when it comes to, hey, I just want to sit down and talk to my doctor, it's probably the hardest appointment to get. You're better off going to your local church, speaking to a pastor about your drug issues or mental health issues. You'll have more access. I'm Catholic. So we have, what's it called? Confession.
Yeah.
And there's like a little box, right, that you go into and you can talk to your priest. I don't need to make an appointment. I
Never
go in,
thought-
I could
never
talk to
thought
the, I
about
could
that.
talk to the priest, or I could talk to a pastor. I could talk to anyone about my problem confidentially. You have more access and more immediate response than picking up the phone, looking into your, preferred provider network, trying to find someone and actually get them to respond to you and actually have a timely meeting or appointment that can be made to deal with the anxiety, the depression, whatever else.
Which is sad. There's more access in, with the priest. That's funny. I want to make sure though, because we had a lot of questions on this, like mental health parity. It's very complicated. It's it's expensive, quite honestly. I mean,
Well, it doesn't have to be if you work with Phia on mental health parity.
yeah. So help me understand, like how many employers are actually compliant with mental health parity, and if not, what do they do?
Okay, I can't give you the actual number of employers, but I can tell you a percentage of employers that are compliant. Less than 2%.
Less than 2% are actually compliant.
It's because it's very complicated, and all the rules regarding mental health parity, there is so much gray area in regards to it. So a good example, right? Let's say that you get a letter in the mail to the employer. It goes to the HR department, and it says, we're auditing your organization. The Department of Labor is going to audit your organization relating to your mental health parity. You're freaking out, right? You're like, what does this mean? Yeah. The number of auditors, by the way, has increased. I think they added 500 more DOL auditors at the beginning of 2025.
Really?
500 more the previous year. Yes. So the amount of information you have to gather is not simple. It's not easy to even gather the information. So it's not just, okay, give us your plan doc. Give us your, an employee handbook. It's, okay, I, as the employer, can give you that stuff, no problem. We want all the pharmacy data.
Get that from your
you have
PBM.
to get that from your PBM.
If you can get it.
Another whole topic that you have for your next podcast, right, is getting the data from the PBM.
Yeah.
Even when you get the data from the PBM, a lot of times, what does it say? RX. Yeah, I know. It's RX.
I need more for this compliance audit, mister.
Bingo. I need more there. Oh, I need all the data in regards to claims going back how many years. We need to see all the access points to make sure, because again, not every plan, as you know, is just using some national network. Today, unlike 10 years ago, there are direct contracts with facilities. There are direct contracts with specialists. There's carve-outs for dialysis. There are narrower networks. There are specialty networks. All this information has to be gathered, collected, and then sent to the auditors. So
Gotcha.
you have a 30-day period of time. By the way, every single plan, before you get an audit notice, they assume, the DOL, the Department of Labor, already assumes that you've tested your plan for parity.
Wow.
Right. Nobody tests their plan for parity ahead of time.
Because it's so complex and you have to get the data. And if you have a more creative plan, that's more work and more analysis.
Who has the time to do it all? You're making the bet, right? I'm a gambling man, right? I like to gamble, but you're making the bet that we're not going to be audited. And if it happens, all right, now we have to respond. So the problem is just, so we at Phia, one of the key things that we do, and we try to keep it as simple, again, simplicity, okay? We have a report card where we ask for certain information. We're talking about a cost that is not tens of thousands. It's like $2,000, depending on the plan.
Okay.
Where we get the necessary information and then give you a report card. So it's basically a shortened, abridged version of an audit. And go, check, check, check. Your problem is pharmacy. Let's get some more information on that, so that you're already prepared and you have everything ready, so that if you ever are audited, you're good to go. But you know what? Forget the audit. Don't you want your plan to do right by your employees?
Right. To be fair and equal.
I was at a conference last week, and it's something that no one ever talks about. And it's probably the first time in 20 years, the overall conference theme wasn't innovation. What if? Like, the
synergy,
future.
strategy.
You know what it was? And this was a TPA, a very large, huge TPA
What was
in this
it?
country. Affordability. The theme literally was affordability.
Okay.
And I was so happy.
Yeah.
Because to be honest, I'm sick of how many, innovation and self-funding. Great. It's not affordable. I could give you access. All right. I don't know how much money you make, right? I don't know what your situation is at home. I don't know how much money's in the bank or how much you might own Bitcoin.
You never know. You never know.
I could give you access to all, McLaren, here's your Porsche, access to everything, every car you want, access to the nicest houses on Park Ave. Yeah, but
If I can't afford it.
Bingo.
Yeah.
And that's the problem with mental health parity is that same thing. It's, okay, you're compliant, you have access, it's not affordable. I can't afford a deductible. So even though, yes, you have parity, you have a $15,000 deductible for your family on all your medical and a $15,000 deductible on your mental health. The person can't afford $300 to pay for their groceries. So, okay, you have equity, you have access, but the people can't afford the actual care.
Gotcha. So basically, at this point, they were out of equal. There was more beneficial enhancements to the medical plan. We make them equal, but if they're both unaffordable, then what does it matter?
To have a 3-day conference where the entire theme was based on affordability and what we have to do to actually get the pay. Remember, everything revolves around the patients. I have this amazing program. Patients don't know about it. It's not going to save you any money.
Doesn't matter.
I have all these things, but if people can't actually afford to do it, a simple thing might even be they can't. Oh, there's a hospital they go to 20 miles away. You and I assume that you can afford a car. There are plenty of people in this country that cannot afford reliable transportation.
Yeah.
How are they getting to that appointment 20 miles away? Have you thought about how you're going to take care of the Uber? Or how you're going to get them a bus? Or how you're going to get them a transportation or a van? Those are the kinds of things that are not talked about.
The social determinants kind of conversation, but like actually making it practical.
What we have seen since COVID, and I'll tell you, I think, that can never, the mental health parity issues and the access issues and the cost issues have gotten so much bigger ever since COVID. I mean, I'm lucky, okay? When I graduated high school, 1992, yes, I'm that old, right? It was a different time. I can't imagine in 1991 being told, yeah, you're going to work from home. I mean, let's just pretend we had internet. Okay, we didn't have that stuff, right? Oh yeah, no prom, no homecoming.
Yeah.
No any of these things. How that affects people later in life. There is no question. I mean, we both have 4 children, right? Mm-hmm. I talk to my kids' teachers all the time. There is a gap. I've been told by every teacher, you see a total difference, even the way socially, the children who were stuck at home for a period of 2 years, remote learning, et cetera, in 2nd and 3rd grade, when all those connections happen, it alters them. It changes them.
Yeah.
They're behind a little bit when it comes to other kids. And all those things are tied to mental health. And the sad part is, I have children, everyone, I'm blessed that all my children are all healthy.
Yeah.
But I also have a child with some mental health issues, and I'll never forget it. I never forget the situation where I went to the number 1 doctor, specialist, that dealt with the type of issues that my daughter had, who was 5 years old at the time. This doctor knew my living situation. He knew I'm a CEO. He knew I can afford tutors, after school, private school. And I'm sitting there with my wife. We meet with the doctor. And the first thing he says is that we're going to put your daughter on Adderall. She was 5.
Oh, my gosh.
Okay?
The first
5.
thing.
First thing. And I'm sitting there going, and I got up, and it took my wife to hold me back from literally fist fighting this guy.
Wow.
And the reason I say that to you is because it is personal. Again, mental health, personal.
Yeah, health, personal.
Right. The guy telling me, oh, yeah, you got to pay $300 for your daughter's walking boot. It's not personal. It's like a joke. I could use it as a story for one of my next speeches. But it was personal. And I looked at the guy, I go, sir, you know that if you told me, Adam, your daughter's reading needs to be improved, she needs to pay attention more, how about getting her a reading specialist? How about getting her extra tutors after school? How about, you know what, you go to public school, there's this great private school that does XYZ. Never brought any of those things up. First thing, drugs. Why? Because 99% of the people that this doctor does meet with, it could be a single mom, already working 2 jobs. Here's a pill, magic pill.
Yeah.
Problem goes away.
Done. And his job is easier then too. Yeah.
His job is, but also not even, it is easier, but also in his mind, that's what people want. People want the magic pill.
Yeah.
And once you put a child on Adderall or any other drug, do you understand how hard it is to get that person off? Mental health issues are very different than your knee replacement or your fracture. You get an arm fracture, you go in, get a cast, come back in a couple weeks, cast off, we're done.
Yeah.
A person has a mental health issue, it doesn't just go away.
More complex, yeah.
Much more complex.
Yeah.
So the issues in regards to the auditing process, I think one of the things that every plan should do is just be a little bit more proactive.
Okay.
Spend a couple $1,000, get a report card done, make sure their plan is compliant on all sides, and then based on our review of what we see, we're going to tell you, here's where you may have an issue. And not only for the audit, but for the benefit of your employees. I mean, as a CEO of a company with 300 people, you don't think I want the head of my accounting department to actually be focused on the job and not thinking about his daughter's mental health problems,
right,
or his son not being able to have I mean, it's going to affect his performance at work.
It is, yeah.
So that's why I think, obviously from an auditing standpoint, it's important that you respond. There's penalties, there's fines, et cetera, which could be tens of thousands of dollars, depends on how bad, how severe you're.
If you get audited, that could be your penalty. Okay.
But the biggest penalty you're going to have when it comes to your audit is the amount of time it's going to take you and your administrator and your broker just to gather all the documentation, the back and forth. It's like being audited, knock on wood, that I'm never audited for my taxes, right? Stressful,
yeah.
And it takes up time that you otherwise would be working on your business.
Right.
What we try to tell employers is, okay, not just for mental health, but for your entire plan, let's make sure it's accessible, that there's affordability in there, and that you incentivize the people on your plan to care about the cost of care. Most of the appeals that we see when it comes to mental health, it's based on cost. It's not based on the need. So you don't see, again, asterisk there, most. You don't see administrators denying care or denying a claim, oh, your son really doesn't have a heroin problem, he's fine. That's not what happens.
Yeah.
It's, we're not spending $180,000, we're willing to pay them $50,000. It's a cost issue, really, typically when it comes to audits, appeals, when it comes to this whole world of mental health. And the problem that we see is because the way people watch TV, commercials on television, etc. Look at that place, the Malibu place. Look at this, ocean breeze. I'm going to send my kids there, they're going to be magically cured. No patient, no members are focused on the overall cost of the care. It's just, I like that place. It looks nice. It's got a nice commercial, and they're going to cure my child. They're going to fix my child.
All right, so tell me this. Is there an employer you've worked with that's gotten proactive about this sort of thing, where they've said, you know what, if anyone is going to have, a situation where someone has to go into a facility, let's use this one? I mean, have they done that? I mean, tell me about that.
Unfortunately, I wish there were more, but we definitely have hundreds of clients, thousands of plans that have proactively done what I just said, where we do a report card, we help build out the plan, even if it's not ready for 2025, to be prepared for 2026, to have all their ducks in a row, as a perfect example. Just remember this, if you are audited, if you have an appeal that goes the wrong way, we're talking out of pocket costs for the employer, it's hundreds of thousands of dollars that you're going to be paying lawyers, legal fees, just to represent your interests, etc. How the appeals process works, you have a first level appeal, comes into the administrator, let's say they deny it for charges that are too excessive. Great. you're pretty much what they're banking on. The large carriers, the fully insured carriers, and you hear about denials all the time, right?
Yeah.
AI and all that stuff, is they know that most people won't appeal, or they don't know how to appeal,
Yeah.
or they won't do it timely because why? Going back to what we talked about, they don't read the plan doc. However, when it comes to mental health, they appeal. Kid has an addiction, girl has depression, they appeal.
Yeah.
That second level appeal is the last chance you have to make the situation right, to make sure you are reasonable, prudent, independent third party has reviewed it, hence Phia Group, where our company can review it. So you can say, hey, listen, we did right by everyone. We not only, when the second appeal came in, the final appeal, we sent it to a well-respected organization that does this every single day, and they said what we did was kosher. Mm-hmm. That's a big thing. Because once the final appeal is done, that's only then can any patient, facility, etc., sue you in a court of law.
Okay.
So you got that one last chance. Unfortunately, a vast majority of employers and administrators don't have a different process for that final level appeal versus their first appeal, and they're just opening themselves up to a potential lawsuit, which instead of paying $3,000, $4,000, $5,000, or a full audit by an organization is under $20,000.
Mm-hmm. Okay.
You're looking at $50,000 to $100,000 cost to use an outside law firm, especially when it gets into litigation. So instead of spending, $10,000, $20,000 and being proactive and making sure that all your ducks in a row and you have an independent third party doing that final level appeal, you're looking at spending $50,000 to $100,000 if it does go to litigation, potential fines, etc. And you got a workforce that knows what's happening because all this litigation is publicly known.
Gotcha. Yeah, you don't want to get to that point. You want to do it proactively.
You probably don't want your employees to know, even if you're in the right.
Right.
To know, oh, you're not paying Sally's claims? Sally's been working here for 25 years. How dare you treat her this way?
Yeah, you're being audited? Yeah.
Right.
Yeah. Well, okay, this has been super helpful. Like I said, we had a lot of questions on mental health parity. I think it's a lot of questions. What do you want to leave our listeners with on this topic of mental health parity before we wrapped up?
If you can't tell that I'm passionate about this, then, I have
we
not
can tell.
had lots of cups of coffee
We
today.
can tell, yes.
This is all, folks, this is water.
Yep.
I love this industry. I actually feel like it's very rare to have a job where you feel you're actually making a difference. And we change people's lives for the better every single day. We do everything we can to lower our overall claim costs, ensure higher access, better access, higher quality outcomes. So all I would ask people is feel free to Google my name, Google my company, follow us on social media. And we have so much free information out there because, again, why do you do it for free? Well, to educate the public in regards to what their rights and obligations are. We have our tagline of our company is empowering plans. Mm-hmm. And what people have to understand is the word empowerment, what does it mean? Empowerment means giving people rights and power that they didn't realize they had in the first place. And that is self-funding. Most people aren't even aware their plan's self-funded.
Yep.
And they're in a self-funded plan.
Mm-hmm.
The number of friends I have that I'm like, oh, they go, oh, this company XYZ. I'm like, oh, you're a self-funded plan. They go, what does that mean?
I'm a what?
No idea.
Yeah.
But I would just ask that people could reach out to my organization. We have so many people that, I have a group of 20 plus professionals, 10 plus attorneys that know mental health parity, the rules, the process, the regulations, much better than I do.
Yeah, they do the reviews.
It's all they do every day.
Yeah.
And we would obviously talk to anyone that would reach out to us. And anytime we talk to a potential client or someone in the industry, our first consultation is always for free. So,
Awesome. Well, thanks so much for being here, Adam. It's been super helpful. Thank you.
I appreciate the time and the opportunity and would love to come back anytime.
Awesome. Thanks.
Thank you.